Hi, everybody. I believe we are live. This is Amy Lundy. I am obviously with the Mother of All Baby Showers. I am delighted today to be joined by Dr. Clark from NightLight Pediatric Urgent Care. I am really excited because I actually got to hear Dr. Clark speak at the event on March 5th in Houston a couple weeks ago at our phenomenal Houston event. What a great event, right?
Yes, it was.
And so I had the luxury of hearing from this phenomenal physician at the event, answering a lot of questions that are top of mind for all expectant or new parents, no matter what phase of life you're in. The reality is that pediatric care lasts all the way through until your child is essentially no longer a minor. So I know I still went to my pediatrician up until I was like 16 years old.
Some people up to 21.
Exactly. So this person becomes an integral part of your life. I think what we were just talking about before we went live was how, as a expectant parent or someone who has just had a child, you don't even know what you don't know, right? So I think that's part of what we're here to help with, is to help you think of things that maybe you haven't thought of yet that you would eventually think of. Don't worry. But we're trying to get you there a little bit sooner. And essentially what really stuck out to me and why I really wanted Dr. Clark to speak today, and why we always have an urgent after hours care pediatric practice involved pretty much all of our events, is because something you probably didn't realize is that your pediatrician, your pediatric practice for your child or child to be, is not open all hours of the day and night. Chances are, and I think they're probably all like Googling, what are the hours? Chances are your pediatrician's office closes at 4 or 5, and in many cases isn't open on the weekends. There's usually going to be somebody on call, so you will be able to speak to someone, maybe in a timely manner, maybe not. But the reality is, if you're a first-time parent or you are an expectant parent, you are going to be a little more worried. You're going to be a little more concerned about, is this normal? Should I go see somebody? You're going to want to see a doctor face-to-face. And that's really where a company like NightLight Pediatric Urgent Care comes in, because they have the hours. They're going to help you during the wee hours, during those hours when you're awoken from your sleep to a child screaming, there's a rash, there's a fever, they're crying inconsolably, whatever the case may be, where you need somebody right away and you don't have time for a doctor to call you back, or you don't have time to wait till the next morning when you can get an appointment. So really, we're going to talk about all things pediatrics. We're going to answer questions. We're going to have a discussion around what are some of the sort of hottest topics that do come up. And so I'm going to introduce you now to Dr. Clark, as you can see. And again, she spoke at our Houston event, super knowledgeable on all kinds of topics. And I think what we're going to do is just like jump right into it.
Okay.
Because I have tons of questions, and I heard the questions that were asked at the event. So we're going to throw some of those out of this audience. Now, we are fully aware that you are all coming from all over the country, and that Dr. Clark cannot be in all places at once. She is in Houston. However, you have aftercare companies essentially for pediatrics in every single one of your major cities at this point. I mean, I don't think there's a city we go to. We're in 11 cities this year, and I'm fairly certain that there is some kind of after hours urgent care option for pediatrics in every market. So, not to worry, and we can help you. You can always email that, and we can tell you who our partners are in the other cities as well. But so one of the hot topics that still comes up that we get questions about, that we're posting articles about all the time, is the flu. So first off, from the standpoint of children getting the flu, Dr. Clark, is it true or false to say that the flu is worse this year than it is in past years?
I think the flu, there's been kind of an epidemic where the vaccine wasn't as effective this year. So I don't necessarily think the flu itself as an infection is worse. I think that the flu has just been kind of running havoc this year because the vaccine wasn't actually that effective. I believe it was about 10 to 15% effective this year. And how they make the vaccine is they try to gauge what strains are going to be prominent each season. And so some years it's better as far as like they're kind of more on the mark, and some years it's just not as accurate as far as being on the mark with which strains are going to be more prominent. So I think this year it just wasn't, they didn't hit the bullseye really well as far as, covering the strains that have been prominent this year. So the flu has kind of ran havoc, and a lot of people contracted it. And the age ranges where it affects people the most are our smaller babies and younger children and older adults. So they tend to have, a more severe illness compared to older children or young adults.
So are you still advising, I mean, here we are in mid-March. Are you still advising people who are still asking, should I get the flu vaccine? Should I get my child vaccinated? Are you still recommending that they do get the flu vaccine this late in the year?
Absolutely. I think it's still coming around. It's not as prominent as it had been around November, December time, but I, still see a few cases each shift that I work, and I work about 3 to 4 shifts a week. So we're still seeing it. So even though it wasn't as effective as previous years, I still recommend getting it if your child's old enough to get it.
You heard it here first, everyone. It is not too late. You should definitely still get it if you're questioning that. I know people are still asking about that. And what is the right age? Is it over 6 months? Is that what it is, Dr. Clark? Beyond 6 months, you recommend?
Right. So starting at 6 months is when you can start getting the flu vaccine.
Okay, great. And I know in past years they had a nasal one and then the shot. Is it still both options this year?
I believe the nasal flu vaccine is not on the market anymore.
Okay.
Now it's just the injectable vaccine.
I think you're right. I don't think they offered that to us.
Yeah.
Okay. Let's stick on the vaccination topic for a second. I know there's options for how to vaccinate, and it sort of depends on the doctor and what they recommend. Some people ask, do I have to get them on a certain schedule? And is there sort of a general schedule for the vaccinations for that first year?
There is. And, starting from birth on up, usually around 12 months, there's definitely a set schedule and ongoing even till, children are 18, they're getting vaccines. So we do have a schedule set in place, and it's set that way for a reason. But, there are some families who want to do kind of delayed scheduling, and that's something to discuss with your pediatrician. Vaccines.
We were just talking about this.
Yeah,
hot topic. We know it's a hot topic.
There's some controversy surrounding them, but in general, a vaccine is simply killed or live portions of an organism, whether it be a virus or a bacteria. And the whole sole purpose of it is to expose your body to a weakened form of this organism so that if it saw it again in its full blown, capacity, that you could fight off that virus or bacteria because you've already been exposed to it. So the thought of the vaccine is not to give your child that infection, but to just expose their immune system to it so that if they were to see it again, if they contracted it again, they can fight it off and they're not going to get the full-blown infection that's associated with that organism or virus. So we do have a schedule set in place that we use, but there are, other options that some families will choose as far as giving vaccines on a more delayed schedule.
Okay. What about side effects? What are some common side effects from those vaccinations during those first 12 months?
So you can get low-grade fevers associated with vaccines. You can get some irritation at the injection site. Some kids can be fussy, just a little bit irritated. But in general, those are more the the side effects that we see associated with them. Now, some kids, if they have like severe allergies to certain components that they make the vaccine with, they can have more severe like allergic reactions. For example, some vaccines have egg products, and if your child has a significant allergy to egg, then we have to be cautious with giving them those vaccines. But in general, fussiness, low-grade fevers, and you can have some irritation at the injection site.
Okay, great. And I know from going to vaccines with 3 kids right now, that they would always sort of warn you about the possible side effects. At what point do you think, for especially for a new parent, where they're maybe going through that first round where the child's a few months old and they're getting those first vaccinations in, at what point would you say that someone would come in to NightLight, or what do you see in NightLight, people coming in and saying, hey, my child had an adverse reaction to such and such vaccination? At what point does it seem like more serious than just, okay, it's a low-grade fever? When do you recommend to come in?
So if the fever is very high, like 103, 104, if your child is crying like uncontrollably, unconsolably for hours, if you have significant irritation at the vaccine site, it's worth getting your child examined and looked at, just because those are not kind of in line with what the side effects we typically will expect with vaccines. So I would say if there's extremely high fever, if your child has, significant redness, irritation, tenderness around the injection site, because we're doing an injection, you can, there's always possibility you can introduce bacteria into the skin because you're making an opening so they can get infections at the vaccine site if there's bacteria that gets into their skin. Or if your child, very unconsolable, or if you just feel uncomfortable with how your child's acting, parents know their children the best. So if something is off, they're usually the first ones who can tell that something's wrong. So I always tell parents, if you are concerned about how your child is acting or what's going on, then that by all means get them looked at.
Okay. What I'm going through my list of questions. When do you recommend giving a baby medicine for pain or fever? Like, what is, I guess, sort of the age in which you're allowed to do that? Is there a certain amount of months they need to be where you're recommending that? And like you were starting to say before with some of the side effects of the vaccinations, is there a certain level of fever? Like, wait until it's this high of a fever before you give this?
So a fever we consider 100.4 or higher, and so you can treat that with Tylenol or Motrin. Tylenol can be given from birth ongoing, but Motrin is not given to kids until they're 6 months because it can cause issues with the kidneys if they're too young. So we reserve Motrin to start giving Motrin at 6 months and up. But in general, low grade fever is 100.4 up to 101. Those are low grade and more in line with what you can see with vaccines or with a viral illness. But regarding fever, it's a little bit complicated because the way we handle it and some of our guidelines for fever management depends on the age of the child as well as vaccination status. So there are some age range where fever, regardless of what the temperature is, 100.4 or higher, they need to be seen. And one of those age groups is neonates. So the 0 to 28 days of life. That's when, we have to see those kids, even if, they have fever of 100.4 or higher, they have to be seen.
Wow. Okay. Okay. Here's always a tough one because I don't want to scare anyone. What do you do if a baby is choking?
So if a baby is choking, the first thing I would think, if the child was just eating, then you want to turn them over kind of with their belly facing down and kind of put their head down. I wish I could kind of.
I know, I'm thinking, where's our baby doll that we normally have for these demos?
If they're choking, if you can actually see what they're choking on, then you can try to take it out of their mouth. But if you can't see
I have done that more times than I want to admit. The amount of times I've had to use my clean finger, thankfully, to go back there and, yeah.
Right. So if you can actually see it, you can try to take it out. But if you can't see it, I wouldn't advise going in there to try to feel around, because then you could push whatever it is deeper down into the airway, the respiratory tract. So
I'm going to grab the doll. You keep talking. I'm going to grab the doll.
Okay. So I would, turn them over so that their stomach is facing the ground and kind of tilt their head down some. And you want to pat their back a little bit firmly so that whatever.
So basically you have them down like this. I got to make sure they're in the camera, right?
Right. So you can kind of
And
use your arm and you want to pat their back pretty firmly to see if whatever they're choking on will come out.
like,
But commonly with babies, they'll sometimes cough and gag some on their formula. And so you
yeah,
can
yeah.
turn them over quickly and pat their backs, and, make sure they're not having color change, like turning blue around the mouth. Is concerning. And so after that, I typically will recommend getting the child seen after you've kind of got them a little bit
To
settled.
make sure they're okay. Yeah. So around the discomfort topic for children, so I am in it right now with an 11-month-old I was just saying to Dr. Clark, she has no teeth whatsoever, but she is clearly unhappy in this area because I think teeth are starting to come in. So what is your kind of feeling for like the best solutions out there for a teething baby to calm them? I can tell you back in the day, I won't incriminate anyone, but let's just say someone who may or may not have taken care of me may have used whiskey on the gums.
Yes.
The things that parents were allowed to do in the 70s and 80s so that your children could sleep. We have a lot of teething products we work with. This particular one is from one of our favorite brands called Uga. They are really someone who's worked with us for many, many years. And, we pick a lot of our products based on what our team members and myself, what we have used and what have worked really well for us. What I like about this is silicone. It's totally safe. It's washable. It's also cute. But I throw this in the freezer so that when my daughter chews on this, it's super soothing. So what kind of things have you recommended for the baby that just seems inconsolable related to the teeth coming in?
So definitely teething rings are helpful. That coldness kind of helps to soothe the gums, because what happens, the gums get very inflamed and they get red and irritated because the teeth are popping through. And so that coldness kind of numbs the gums so they're not feeling that tenderness and pain. Also using
no whiskey on the gums, right?
I don't recommend that. I've heard of it being used before, but yeah, we don't recommend that. Teething rings, also giving a little bit of Tylenol or Motrin is helpful too, because that Motrin actually works really well with decreasing inflammation, so it will help with some of that gum swelling and irritation. So we try to stay pretty conservative as far as our management of teething, but just treating the symptoms accordingly. So the teething rings and Tylenol or Motrin are the main things that we recommend.
Best remedies. Okay. As I put this back in this baby's mouth, this pacifier, it's our office baby doll, because my child certainly would not sit this calmly during a live broadcast. Thoughts on, I will tell you, pacifiers. My first child, my oldest, no interest whatsoever in pacifiers. Not at all. My son loved pacifiers. My daughter loves pacifiers, but they are very specific about the types of pacifiers. So it's a good thing that they make, 50 different kinds or more of pacifiers out there. And this is kind of hard to see, but one of the brands we work a lot with is MAM. What I like about these is that they're very small, easy to kind of throw in a bag. They're also very cute. It's hard to show it on here, but they're very cute. And so we use those a lot. And these ones right here are for newborns. But what are your thoughts on pacifiers? Yay or nay? I know that a pediatric dentist will have their thoughts too, but what are your thoughts?
I think, with pacifiers, it's a little bit of a love-hate relationship, because initially there have been some, recommendations that they help to prevent SIDS, which is sudden infant death syndrome, because they stimulate the baby to suckle. Sometimes babies can have periodic breathing where they'll kind of stop breathing a few seconds and then they'll start breathing again. So having a pacifier in their mouth helps to stimulate that. But as they get older, it becomes more of a behavioral thing and a comfort thing, and it can be difficult to, get them away from the pacifiers. I've seen 3, 4, 5-year-olds still sucking on pacifiers. So
me too.
Then once they start to get teeth and things, it can affect how the teeth are coming in. So I definitely, I recommend them initially on, but you want to, be diligent about getting your child off of them, as soon as possible. Once they start, eating solid foods, having teeth, I would try to, get
So
there.
what would you say? Around a year-ish?
Yeah, at the most. Yeah.
Okay. Okay.
Yeah.
Oh boy, I have 1 month to go and I got to wean her off of this. Thanks for the warning.
The best
Okay.
way is to just throw them away. They're
I
gonna
know.
cry and fuss,
There's
but
people have all these cutesy ideas, attach it to a balloon and send off the balloon and say bye bye patsies.
yeah.
I was the same way with the transition from bottles to sippy cups, from formula to
hmm
milk. It was sort of they went to bed and the next day when they woke up, the bottles disappeared. There was no
hmm
more bottles to be
Yeah.
found. So I sort of had the same strategy. I think where parents have a tough time with pacifiers is bedtime. It's
hmm
that soothing time. And so what I find is a lot of parents, the daytime is totally fine. The kids is so busy they don't even think about it. But then by nighttime, that's when they're thinking about it.
hmm
Yeah. That's when they want it.
Yeah. So thanks.
It's
You
tough
can
to,
kind of just, distract the child or try to get them a new, a teddy bear, something new that can be soothing to them, so
yes.
that, they can, take their mind off the pacifier. So maybe introducing a new teddy bear that can now be their, soothing, thing that they like to have when they're going to bed.
Yeah, we swap this out for this.
Right.
Yeah. Well, and I think that's an interesting point, kind of back to what you were talking about. I mean, obviously, with our events, we have a big focus on safe sleep, which all fits into really the pediatric care side. And you
hmm
mentioned SIDS, sudden infant death syndrome. And, there are a lot of rules to the sleeping environment for that first year.
hmm
And then the rules change as your child, goes on. And ideally, as the child is more mobile, I mean, my child is 11 months old. She picks herself up in the crib and it's a third child thing. She's trying to get out of the crib already. But I think by the time you get to that year plus mark, what are the recommendations? I mean, obviously at a certain point during that first year, they want you weaning off of the first year. I know they don't want blankets in the cribs. They don't want stuffed animals in the cribs. They don't really want anything in the crib. No bumpers, nothing. That is the
hmm
safest sleep environment. But
Right.
then what about when you hit that sort of now they're moving into the toddler phase?
Um,
What's the sort of thought process there about what is allowed in the crib? Because you mentioned, get rid of the passy and put in a stuffed animal. Now, are we allowed to have a doll in there? What's sort of the thought process there?
I think the with SIDS the issue is with babies they're not able to move around like you were saying, and so if
Right.
something was to cover their face, they're not able to roll around. So if something was to cover their face, then they wouldn't be able to get it off. Okay, so I think
Yep.
small stuffed animal is fine. You don't want to have multiple things in the crib. Obviously, you don't want to have anything that your child could swallow. Any small things. You don't want to have excessive amounts of blankets. So we definitely still recommend sleeping on their back and having minimal items inside of the crib. So,
Right. My, it was interesting from the first child to the third child and some of this I think is based on the hospitals and how advanced they are and sort of what information they have and how quickly they are sort of changing things with regards to various kind of safety piece of the travel. With my first child, it was a no-brainer. It was swaddling. It was all about the swaddling, and the baby was wearing the hat for weeks. I mean, there was a hat on a baby for I think my first wore a hat for the first month. Now with my third child, okay, we're skipping over the second one because he was born 2 years after my first, so it was pretty similar. By the third one, things seem to have changed, at least in my hospital in South Florida, and now all of a sudden they aren't pushing the swaddling really so much.
mm-hmm.
And furthermore, they really only want them to be like swaddled and super warm that first 24 hours. And then they feel like they should have regulated their own body temperature, the child that is, and shouldn't need all of that bundling up after the first day, including the hat. So now after the first day, they're telling you that kid should not be wearing a hat. Your baby should not be wearing a hat at home. Your baby, I mean, listen, obviously if it's, 0 degrees outside and you live wherever you live, it's one thing. But just in terms of keeping the body's temperature regulated inside the house, they're saying no, you shouldn't keep the baby swaddled all day. You shouldn't do the hats all day, which is all new,
Mm-hmm.
right?
Right. So I think, I always recommend to parents, however many layers of clothes you have on, you can, maybe put one extra layer on the baby, because you know they overheat too, and a lot of times babies come in and they have like 50 blankets wrapped around them, especially if it's a little cold out and in areas where they're not used to having cold weather, so they get you know, really concerned. But in general, your baby only needs really one extra layer than what you're wearing. And then swaddling, not only does it help to keep the baby's temperature regulated, but they've been cooped up in this belly for so long. They really like to be kind of snuggled and
snuggled up. Yeah.
Snuggled up. So that's more of a soothing thing as well. But obviously you don't want to swaddle the baby too tight. But a good swaddle does help as far as, you know, comfort for the baby and keeping their temperature. But in general, you don't want to have excessive layers on the child.
Okay. Good to know. Let's move into kind of the past the newborn phase. Now we've kind of gotten into a little bit of the infant phase. And then thinking ahead, let's talk about, you know, and every doctor is a little bit different, but we introduce solids, I think around 5-6 months or so for our children. And, you know, listen, to each their own. I am a big fan of Happy Baby because I think they use very good, fresh ingredients. If it says apple, sweet potatoes, and granola, that's really what's in here. And just to be fair, this is a 6-month plus, so this is actually a stage 2. They have a sort of more liquidy forms in stage 1 across the baby food types. And if you're feeling very, very brave, although actually I will tell you I've done it before, it's actually very easy. You could do what's really the healthiest option for your child, and you can make your own baby food. And that's very easy to do. Plus they make baby food makers to puree it, and then you could actually buy these, which are these amazing pouches, which are reusable from Sage spoonfuls, to actually put the food in. And it can tell you, tells you how much food you're putting in and whatnot. Very easy to clean, yada, yada, yada. So, and these are also freezer safe, by the way. But what's the recommendation from your standpoint as to when to give solids, when your child is ready, how old, and what really to introduce first as far as which foods?
So anywhere between, like, some pediatricians are a little bit more aggressive, like you said, and can even start introducing solids at 4 months. But typically, between the 5-6 month range is when we find that it's appropriate to start. And what you want to do is introduce one type of food at a time. So if you're doing peas one week, you want to just do peas, and then the next week you can still do peas but introduce a different solid. So the reason we do that is to determine if your child's going to have any specific allergies to certain types of foods. So that's why we say not to introduce a whole bunch of different things at once, because if they were to have an allergic reaction to something,
how would you know which one it is?
Know which one it is. So we say to just, go slow and do one at a time.
Maybe one food, basically like one food a week to try for that week to see how the child does.
Right. And then the next week you can still give them that food because they didn't have any issues.
And on to the next.
Just introduce a new one.
Yeah, easy enough. So somebody just asked a very good question. Robin asked, is it okay for babies to sleep sitting up or elevated? What's your opinion on that?
So typically we want them laying flat on their back. Sometimes we will recommend elevating a child some if they have issues with reflux. And so what that does is
I had one of those.
Yeah. So some of the things that we recommend for reflux precautions is to elevate, the child's bed some, so that it kind of promotes things to keep going downward. But in general, we recommend that they're flat on their back.
Lying flat in the safest place, which is a crib or a bassinet or like our cribettes that we use. I think a lot of people end up having questions about, what do I do? My child falls asleep in the car seat, in the stroller. Are those places safe for the child? And the simple answer is, I'm going to let you speak to it, but the simple answer is no. They should not be sleeping there. That's always been my understanding, but maybe you want to talk to that.
So certainly I'm sure it happens like in the car or, but in general, if they're being put down for bed or long extended periods of time where they're sleeping, we prefer that they're laying flat in their crib or bassinet on their backs. But, certainly babies fall asleep while they're on car rides
Of
and
course.
things of that nature. And so typically it's safe. But our smaller babies or our preemie babies, sometimes that can be an issue. So one of the precautions that we typically will take with them is doing car seat tests in the hospital before they go home, where they're
Oh, yeah,
hooked up
great.
to monitors and everything, and they're put in their car seat for
Making sure they're breathing in their heart rate. I
right.
remember doing that. Yeah, with my first one was a preemie, and I remember going through that. Yeah, because I've always heard in terms of safe sleep that, and also in terms of car seat safety, so it works both ways because those are always hot topics at our events. That of course they fall asleep. My daughter, thankfully, sometimes that's the only time she wants to sleep is in that car seat on the way to pick up another child. But then when they get home, I think parents are so worried, they're so desperate for that time for that child to sleep. They can get laundry done or cooking done or work done or errands done, that they're afraid to transition them over. But if you know that they're going to nap for an hour or two in that seat, they shouldn't really transition them over because it's not really the safest place for them to actually. Yeah. I mean, I've even found in my swing, which is, which of course my child loved nap. Now she's over it. She's too big, but she loved napping in that swing. But even from another standpoint, it only took about 7 or 8 months until she was already at that crawling point, and she was clearly already turning herself over. And one day I turned around and I came back, and even though she was buckled in tight, she still found a way to move herself off him as her legs were coming out, and which is unlikely to happen in a crib where you can lower the mattress or raise the mattress as needed. It's sort of like better to be safe than sorry idea. But of course, like you said, they fall asleep sometimes. And I definitely had that, the child with reflux. My first, who was a preemie, had reflux. And we were given all kinds of creative suggestions that were all about elevating her to help her sleep. Luckily, the good news is with most children, those things pass.
Right. Reflux
passes. Yeah.
is very common in infants. And, think about it. Their stomach muscles aren't very strong. They're laying down most of the time. So reflux is something that we expect in babies. Now, some babies where it becomes a severe issue as far as them being very uncomfortable, arching their back, losing weight, those kinds of things are concerning, and we will typically, start them on some type of antacid to help with their reflux. But in general, spitting up and reflux is normal in babies. And as they get older and moving around and sitting up, their stomach muscles get stronger, and so reflux typically will go away.
Okay, well, that's reassuring for all those out there who were like me with my first child. I thought, is this ever going to end? And it did. She's 7. She doesn't have reflux anymore. She only had reflux the first few months. Let's talk developmental milestones. Are there certain? I mean, I know the simple answer to this. Are there certain things that a child is expected to do by, say, 3 months, 6 months, 9 months, 12 months, and sort of beyond into those toddler years? And is there sort of one resource that someone could find on the internet, or if there was a book at the library where they could learn a little bit more about those different kinds of milestones for the child, so that they can make sure they're within that range as their child is developing?
Absolutely. So each age range has its own set of milestones. And one resource that I always tell parents about is healthychildren.org. It's actually endorsed by the AAP, and that's the American Board of Pediatrics. And so they make a lot of our recommendations that we follow and practice. And so what they have on there is handouts for each few months of age and what to expect and what your child should be doing at that time. And then at your pediatrician's office, you'll go to your well checks, relatively frequently. And so they will make sure, your child is hitting the milestones they're supposed to at which age they're supposed to hit them.
Okay, great. I'm actually going to put this, I'm making notes as you're talking, Dr. Clark. So to tell people where to go and where they can find information. Food allergies and sensitivities. I don't know what it was. I have no memory of any children with food allergies when we were children. I think there were children. It just was not as widespread, or people weren't as aware, or they didn't associate the health issues they were having with the food that they were eating. But now it is a very serious issue. And now in a lot of schools, such as my child's preschool, there are classrooms that are, nut-free, egg-free, and whatnot. And it's super important that parents take that seriously for the well-being of the child in there who does have those kind of severe allergies. So, but unfortunately, some people kind of make light of the situation. What really can parents do when it comes to, kind of getting the word out about food allergies and how serious they are, and, making sure that other parents do realize that this is a serious matter?
It's definitely serious because some children and people can have very, very severe allergies, and nuts is a particular one that people can have pretty significant allergy to. And even the smell or scent or being around that product, can trigger an anaphylaxis or a serious allergic reaction. So I think, if the pediatrician needs to write a letter to the school, if the teachers, need to send home a letter to parents saying, hey, we have a child in our class that has a severe allergy to nuts. Please, no peanut butter sandwiches, no nut, products for lunch. Very important not to send those things to school. So I think, the pediatrician and the the teacher, advocating for the child as well as the parent is, going to be important for them to kind of work together to make sure that the child isn't exposed to anything that's going to cause them to have a reaction.
Agreed. Another question, but not food allergies, seasonal allergies. It's a big thing right now. Robin asked, do babies have seasonal allergies?
They can. I mean, babies are avid nose breathers, so anything that gets into their nose can give them the sniffles, and they can get, watery eyes and whatnot. So if anyone's going to have sensitivity to pollen or, different, plants and whatnot that come around in the spring and summertime, then they can, develop, those watery eyes, sneezing, sniffling too. So it does happen. It's not usually that common because babies aren't usually out and being exposed to those things much. But in our, toddlers and older kids, you can see them, developing allergies, because allergies, you can't have them unless you're exposed to what's going to cause you to have a reaction. So if babies typically aren't really out and about being exposed to pollens and trees, older kids are more so out playing and things like that.
Yeah, so running around, right.
That's when they tend to, come about.
Well, what about, back to the food question, what about some of those foods that involve allergies, like that are more common, like the nuts, like sometimes gluten sensitivities, things like that? When do you, something like peanut butter is something as simple as that, when do you recommend introducing a food like peanut butter, say that a lot of people do have allergic reactions to?
I think that, there's no set age, as long as, they're older enough to start having solids. There's no set age of where you can introduce those types of foods. But, you just want to be cautious and make sure you're just introducing one at a time, so that if they were to have a reaction, you would, see it,
know that that's what it's from,
pinpoint what it's from. But if there's a family history of nut allergies, if you have another child with a certain allergy, I would be a little cautious of introducing that food, because there's some genetic components to allergies. So I would just,
that's interesting. I didn't know. Okay, so there's genetic components to allergies, food allergies. Interesting.
Yeah, definitely. So some, like, oh, mom, I was allergic to shellfish, and then the child develops an allergy too. So, there's a lot of different components that go into how people develop allergies to certain foods and products.
So it's good to know your family history, and if anyone else has allergies to foods, because that might help you think ahead with your own children, what you want to introduce and in what time frame. Rashes. When is that a significant problem in your mind that needs to be checked out? This is, to me, a very good example of something that wakes you up maybe in the middle of the night or in the wee hours of the morning, where all of a sudden something that you may have thought earlier in the night when you put your baby down to sleep, or when you put your child to sleep, or when you woke up first thing in the morning, looked like just a standard diaper rash. And then all of a sudden, hours later, you're finding they're still inconsolable. It seems like maybe it's spread, it's gotten worse. When do you sort of say, okay, I don't know if there's a diaper rash versus a sensitivity to something, like could be food or something else?
Mm-hmm.
When do you think a rash is a significant problem that needs to be checked out?
I think that in general, if there's mild irritation in the diaper area, that's, commonly taken care of with your over-the-counter diaper creams. But,
Yes.
Rashes, the best thing to do with any rash really is to get it looked at, because a lot of different rashes can look exactly the same, and it
Right.
really takes, someone who is trained to look at the rash and see kind of the distribution of it, what it looks like, what other symptoms the child's having, to kind of determine what's causing the rash. So my rule of thumb is to always just get it looked at by your pediatrician, or you can go to an urgent care to get it looked at.
Always better safe than sorry. I think
Right.
one of the things that tends to happen as you become a new parent is you've got a million people giving you advice. The mother-in-law, your sister who had a baby last year, your best friends, your mom's groups, and everyone all of a sudden becomes an expert overnight, even though some of them maybe had a baby 2 weeks ago. So they are not doctors. They do not have all the answers. This is why one of the main reasons why healthcare is such a big component of MOABs is because these actually are experts. They've gone out and gotten years and years and years of education. They have seen thousands of patients over the years, and they've seen so many things that when you come in there, they're going to know how to treat them based on the experience of seeing so many things. So I am of the same mindset, and I'm not a panicky person. I'm the same mindset that you're better be safe than sorry. And while a call is lovely to speak to someone over the phone and describe something or show pictures to, there's no replacement for actually talking to somebody in person and showing them whatever your concern is. When it's your child, you can never be too crazy, right? I mean, it's your child. I'm going to kind of wrap things up on a lighter note. So, because I think this is a question that comes up a lot. I'm going to show a visual. So, baby fashion, children's fashion has come such a long way. And as a child, I feel like I was barefoot until, even long after I was really walking. I don't even know exactly when I was given shoes. But now, you see babies wearing shoes at very early ages. So we work a lot. This is Pediped. These are little Pediped shoes. I want to make the point of saying they're so cute, right? I want to make the point of saying these are very soft shoes. These are essentially almost like crib-like shoes that you could wear. This has 0 to 6 months. So this is clearly crib shoes. They're crawling around the house in them. They're fashionable. But when do you actually recommend that children should start to wear shoes? Because the truth is that different children walk at different times. Some children walk very early and some walk later. And so what's the general recommendation when it comes to what to put on their feet?
I'm not sure that there's any specific recommendations for that. But, kids start to cruise around 9 months or so. That's when they're kind of holding on to things. And
holding on, moving along, yeah.
And by 12 months is when they start, taking their first steps. So definitely by that age, you want to have a good shoe on them with a good sole so that they can have good grip when they're trying to move around. Nothing too slippery on the bottom of their, sole. So I would, recommend starting around that time when they're starting to really move around and stand up.
Everything before that is just for fashion.
Right.
Not for functionality. It's not going to help your kid get running faster, but they are going to look cute regardless. Right. Well, those are all the questions I have. I think people ask a lot of thoughtful questions. I want to make sure that people know, again, when it comes to pediatricians, you can never be too cautious. When it comes to your child's health, you can never be, like I said, too crazy about making sure that they're okay. If it could be something, chances are everything is totally normal, whether it's the rash, the fever is going to go away, the adverse reaction to the vaccine. These are all very normal things. However, it's always best, like Dr. Clark said, to go to get it checked out. And the reality is a lot of the things that are going to come up are going to be after hours. So for NightLight Pediatric, I want to just let you know their hours if you're in the Houston area. Weekdays, they're open from 3 to 11. Weekends, they're open from 11 a.m. to 9 p.m. And even on holidays, they're open from 12 to 7. Right. So with that said, wherever you're located, today would be a good day, whether you're expecting or you currently have a child, to know and put it in your phone, put it in a notebook, put it somewhere where you're going to remember what your doctor's hours are. And further to that, to know what your closest pediatric urgent care center is closest to your house, within 5, 10, 15-minute drive, so that you have the resource at your fingertips. So that's not another thing that you need to panic about. Mm-hmm. And if you ever want to actually, if you have questions further to this about where to find those places, you can always reach out to us at events@smallfrysociety.com. If you have specific questions for Dr. Clark, you can absolutely post them on this post following this live interview, so to speak. And we will make sure that she gets those questions and we can come back and answer. If you ever have specific questions and you want to speak with her directly, we can connect you to NightLight, so just let us know. But we are resources for you throughout the year. We are thrilled that we had you here today, Dr. Clark. So thank you so much for your time. Thank you for your expertise at the event. Thank you for your expertise today. Hopefully she's provided a lot of answers. I know she provided answers for me that I didn't know before this, and I have 3 kids. So if you're anything like me, you're doing a lot of research on the internet, but we don't have all the answers. So this is wonderful. And the follow-up to this, because I know so many of you are waiting for it, is that we are actually going to be doing a VIP couples ticket giveaway. Much like the Houston event in Austin, we are actually going to be giving away this VIP couples ticket, and it includes a cribette, which is the newest play art on the market and truthfully the safest. Back to our conversation about safe sleep. Mm-hmm. We are also going to give away a $50 gift card to 2 Peas in a Pod Boutique, which is a wonderful store for all things pregnancy and parenting, an amazing swag bag to the event filled with all kinds of products and services. And we are also going to give you earlier access to the event at 6 o'clock versus 6:30. All of this is in addition to the ticket to the game at Dell Diamond, because on April 17th, the Round Rock Express is playing that night. So your ticket to the event also includes a ticket to the game. So we're super excited. And just as always, the entry is very easy. All you have to do is tag a friend in as many times as you can, and that's how many entries you'll get. We'll leave this open until Monday. So through Monday, you can ask questions for Dr. Clark, you can ask questions for us, and you can tag your friends, and each one of those friends you tag will become an entry into the giveaway. And then on Monday, we will announce the winner. So if you have any questions, you can message us, you can email us, or you can post right on here. But in the meantime, we hope everyone has a great weekend. Thank you for joining us today, and we will talk to you soon. Thank you again, Dr. Clark.
No problem.
Take care, everyone. Bye.